Have you ever thought about how often we hear about heart disease, yet it seems like it is happening to someone else? Here's a question I really want to ask, and I want you to think hard. If ever you experience some fatigue, nausea, vomiting, and just mild chest discomfort, would you ever think about heart disease? Traditionally, we have been conditioned to think that heart attack or a myocardial infarction is a disease of men. But worldwide, it is a common and leading cause of death in women as well. I'm Dr. Soma. In today's Athena Women's Clinic YouTube channel, we'll delve a little bit deeper into heart disease. These are basic guidelines. If you experience any of these symptoms, please seek help from your own healthcare professional, or if it's an emergency, call 000. It is important that you understand the signs, symptoms, and the risk factors. It may one day help you or your own loved one. As mentioned earlier, it is a common condition that affects both men and women, but the risk increases after menopause in women. One of the leading causes of heart attack is atherosclerosis. What is atherosclerosis? It is basically built up of clots within the blood vessels that are supplying all parts of the body, heart or brain. So when this happens, the blood flow to the vital organs is reduced, or the clot may actually dislodge and block the blood supply, which in turn leads to the symptoms that a person may experience in the form of heart attack or stroke. Across the board, the risk factors for heart disease are the same. Important ones are high blood pressure, high cholesterol, diabetes mellitus, age, and smoking. The additional risk factor in women is the hormonal changes that happen after menopause. It is important to realize that these risk factors that contribute to heart disease or heart attack, the damage starts at least 20 years prior to the actual symptoms being exhibited. Let's talk about what makes heart disease slightly different in women. As mentioned earlier, diabetes, high cholesterol, high blood pressure, smoking, high alcohol consumption, they are common risk factors across the board. But in women, additional risk factors include pregnancy-related complications, hormonal changes due to menopause. So women who develop pregnancy-related complications like preeclampsia or gestational hypertension are at higher risk of developing long-term hypertension, which in turn leads to heart disease or heart attacks. Autoimmune diseases like lupus also increases the risk of heart attacks. Chronic stress and depression, to which the women react differently, also increases the incidence of heart attacks in women. Pregnancy, oral contraceptive pills, or hormone replacement therapy, they all make a woman's body into a thromogenic state, which also increases the risk of heart attacks. The hormone estrogen has a protective effect on the heart. A decline in this particular hormone postmenopausally unfortunately leads to increased incidence of heart disease. Now we are heading into a tricky zone. This is to understand the signs and symptoms of a heart disease or heart attack, which can be slightly different in women. As mentioned in the beginning of the video, simple things like fatigue, nausea, vomiting, chest discomfort, dizziness, although it looks like it can be mild, can be symptoms of heart attacks. The other symptoms that a woman may experience are chest discomfort, pain radiating to the neck, jaw, shoulder, or unusual fatigue. Because of the atypical presentation of these symptoms in women, women may delay seeking help for a heart attack. So that you listen to your body, most importantly the heart, so you can seek help as soon as it is required. Now let's talk about some of the important ways how to prevent heart attacks. As emphasized in my previous videos, healthy eating is very important. Eating fresh fruits, vegetables, whole grain or whole meal foods will help. Reducing processed foods high in sugar content will also help with your diet. Regular physical activity of at least 30 minutes a day is really important. Starting with walking, you can add on other activities including going to the gym or swimming or yoga or Pilates. Quitting smoking, one of the very important steps. So if it is you who is struggling with smoking, definitely seek a healthcare provider advice as soon as possible to stop and cease. Reducing alcohol intake. What is the ideal amount of alcohol? 0. So it's really important that you bring that down if you are struggling with alcohol intake as well. Managing stress through yoga, meditation, breath work, nature walks, again, will help reduce the incidence of heart attacks. Regular health checks to see if you are predisposed with any of these risk factors, again, becomes important. So So if you had gestational hypertension, preeclampsia, or gestational diabetes, it is important you get these tests screened according to protocol every 3 years at least, so you can identify these risk factors and implement preventive strategies at the earliest possible. So if you are experiencing any of these symptoms, please do not wait. Either seek help from your healthcare professional, or if it's an emergency, dial 000. Thank you for listening to this video. Hope you can follow and implement some of the preventive strategies that has been mentioned in the video. If you have questions and concerns, it's important you visit your own healthcare professional, or you can visit us at athenawomensclinic.com.au to make an appointment and discuss further regarding your concerns. If you did enjoy this video, please share it with your friends so they can benefit from it as well.